So good morning. We're here today with Hazel Mullins here in Carricknavar. Today we're going to discuss Hazel's life as a vet. We're also going to discuss her home farm here in Carricknavar. Also, Hazel's going to give us some tips on livestock management and the breeding season. So Hazel, you're a vet here in Cork. Would you like just to tell us a bit about your career?
Yes, of course. Thanks, Rachel. So I'm a vet for the last 8 years. I qualified from Nottingham in 2013. So I work here in Cork for Abbeyville Vets, which is based in Toker, but there's a branch in Carrickline and also in Blarney. So I've had 3 jobs. So I qualified in 2013. I moved back home from Nottingham in England, and I worked in Kerry for a year and a half, and then I worked in Bandon for 2.5 years. And that's kind of where my love of dairy practice kind of came from. And I suppose then I kind of moved closer to home. Opportunity came up to work for Abbeyville, and it meant that I could help Dad out in the farm a bit more and move closer to home. So these are my cows here, and yeah, it's great. Dad loves me being a vet because I can do all the little jobs, and yeah, so I kind of went a little bit of an alternative route to become a vet. I went over to the UK. So I applied and I did my interview and I got over there and I loved it, loved every minute. And yeah, I made some great friends. I have loads of friends all over England now. But I think, yeah, it's a career, it's a vocation. It's one of those jobs that kind of, you get as much as you put into it, and it's always changing. And I love the fact that every day is different. So yeah, I really enjoy it.
I suppose being a vet, like, it's probably an extremely busy role. Maybe if you just want to run through with us, maybe just kind of, I suppose, your day-to-day kind of duties and how you carry it out.
Yeah, so as I said before, every day is different. So, and it's very much seasonal in Ireland as well, with large animal work anyway. So springtime is our busy time. It's like preparing to go into war, and you kind of, after Christmas, you're like, you know it's coming, and when the farmers come in to buy their dry cow tubes, you kind of realise that spring is just around the corner. So spring is very busy. Spring could start, so generally in Cork it starts around maybe the 20th of January, and late night calls, so you could start, maybe could get call at 6 o'clock in the morning if you're on call, and you could be working till whatever hour of the night, but then you might have the next night off, and then it's generally, so you could have still a TB test in the morning, and then you might finish up a TB test maybe around 2 o'clock, and then you might do calls then for the rest of the day. Generally my day does, on a normal day, finish around kind of 4:30 or 5 o'clock, and starts maybe anything from depends on TB tests. Some farmers start during the milking, so you could be on farm for 7 or you could be on farm for 9. So every day there's no set hours generally, but if you're not on call, I generally do finish around 4:30 or 5 o'clock. Sick cow calls, TB testing, blood testing, herd investigation, disease investigations. You've got your cesareans, your surgeries. Yeah, anything and everything, and then doing videos like this, kind of, there's so many different ways to expand what you do in veterinary. So it's not just, pulling calves, and especially now herd health is becoming such a big driver with the new regulations coming in next year with antibiotics and antiparasitics. I think that side of our work will become very, very, that'll become a large part of our workload, is actually herd investigations and herd health. Yeah.
And I suppose, just as you mentioned, reducing of the antibiotics used on farm, Hazel, I suppose, what you kind of see coming for farmers in general, I suppose.
Well, I suppose a lot of the things are kind of coming in place. So the selective dry cow therapy, I think the antibiotic usage will be lowered. Our usage of certain drugs on farm will be limited. More diagnostics will become the norm, so cultures, fecal egg counts, all that kind of thing. I think, yeah, diagnostics will definitely become a lot more part of farming, and finding out what we're treating and why we're treating it and how to prevent it. So I think it's all the groundwork is there. We just have to put it into place now, and everything. It'll be a new kind of experience for everyone, but we will get used to it.
Yes, and I
Yeah.
suppose, is there any kind of preparation work that farmers can do for this forthcoming?
I suppose look at their medicine records, look where they could be, say if they had a pneumonia outbreak last year and they used a lot of antibiotics this year, maybe they could think of same time next year before it happened to use a vaccination.
Yes.
To look where the disease are happening. So especially with cows as well, mastitis, you know, if you get a case of mastitis, not just to put a tube up, take a sample of that mastitis, put it in the freezer even, and you know, plan on thinking, okay, what is causing this mastitis? Does it need antibiotics? Can I prevent it? You know, all this kind of thing. So things like that, you just need to think, where's the disease on the farm? What did I use this year? And how can I reduce the use next year?
So I suppose, Hazel, it's kind of stop and think for a minute before you pick up the antibiotic.
Exactly. And what is the antibiotic? And, you know, does it need it? Maybe ring up the vet, ask for advice. And I think vaccination will become so much more used now on farms, and it won't be just like an added, it'll just be a must now in future.
Very good.
You know, and that's a good way to go.
So I suppose, Hazel, what advice would you give to farmers, say, that are coming through our livestock services and going purchasing stock?
Yeah, so I suppose purchasing stock, there's lots of different things to look at when you are doing it, but vaccination history would be a major thing to ask the farmer. So, you know, find out exactly when they were vaccinated, what they were vaccinated for, and what they're due, you know, and you know what vaccines they used as well, like what brand of vaccines, and see, like, I suppose ideally if there's animals coming into your herd that aren't fully vaccinated, they should probably be vaccinated with, I suppose the top ones would be IBR, BVD, Lepto, Salmonella. They're kind of the main cow vaccines you know, when you're thinking of buying in cows. So have a look at, maybe if you're buying in cows to your own herd, think about what your own herd is vaccinated against, and maybe make sure that the cows coming in are going to be protected against those diseases as well, because they're going to be naive cows coming into a herd that is protected, so they're at risk. So ideally, if you can vaccinate cows before, get the vaccination up to date before they come into the herd, or else try to keep those cows separate from your herd and get those vaccinations in, and then you can mix in your cows then.
Very good, Hazel. So Hazel, we're just coming in, I suppose, to the end of the breeding season now. I suppose, what advice would you give to farmers, say, for what to be watching for around now, and I suppose to kind of overcome problems?
Yeah, so it's the middle of June. A lot of people would take out their bull kind of maybe around the start of July for spring calving. So you only have a couple of weeks left really to get any of those late calvers or any of cows that you haven't seen bulling and calf. So my general day-to-day lately has been made up a lot of pre-breeding scanning. So it's great to see farmers really engaging with this and really using our skills as vets to go in, pick out your cows that you haven't seen bulling, and finding out why the cow isn't bulling. So whether they're anestrus, so that means they haven't started cycling, they might have cysts, so they're either follicular cysts or CL cysts, so they just stop up, they don't cycle, and you need to use hormone treatment to get rid of those cysts. So these cows, you know, might have become cull cows if I haven't gone out and scanned them and fixed the problem. So look, middle of June, still have about 2 weeks left if you want to, you know, get your cows scanned and sort out any problems. You still have time. And I suppose another thing would be watching your repeats, seeing if they're going up this year. You know, if there's a disease going through the herd, maybe getting bulk milk samples, seeing if there's anything going on, maybe blood sampling, mineral sampling, anything like that you think, is there an issue, or is it just, look, year to year, no breeding season is the same.
So I suppose, Hazel, just touching there on scanning, I suppose what advice would you give on scanning, I suppose, to get correct dates, or would you do a pre-breeding scanning, and what, I suppose, in the fall of the year, then when would you be scanning again?
Okay, so our busy period for pre-breeding would be, so you can either do a whole herd pre-breeding scanning, so that would be kind of before you start breeding. So that would be kind of in around April, mid-April. We've had a couple of herds do that this year, and they got, you you'd pick up problems very early. Then a lot of people might AI or have the bull in for maybe a month and then pick out the cows that they haven't seen bulling, that have been calved for over 35 days. That's kind of the marker.
Right.
Because under 35 days their uteruses are still they need to involute and be ready for calving again, or for going in calf. But pregnancy scanning then, ideally you should be maybe scanning when they're about less than 3 months. So over 30 days, but less than 3 months for exact dates.
Right.
After 3 months, then it can get a little bit more difficult to give an exact date. But September is a very common time for the pregnancy scanning, maybe of a whole herd, because every cow will be over 30 days in calf. But then there could be some cows 4 months in calf, so it becomes a little bit more difficult then.
Yeah. So I suppose for the springtime, your cows in September, they're kind of around 5 and 6 months kind of bracket. So that's a little too late, Hazel. Is it kind of for exact dates?
Yeah, so anything especially over 6 months, it's very difficult to exact date, because the calf has become so big. You're kind of relying on cotyledon size, and they're the kind of buttons on the uterus that you see. So you're not actually measuring the size of the calf,
right? Okay.
The little fetus, which is quite simple on a scanner to do when you like, especially around the 6 weeks to up to the 3 months. But after that, it can get a little bit more hazy. Yeah.
Very good, Hazel. And I suppose, Hazel, the breeding season in general, has it gone okay for farmers, or kind of what kind of feedback is there at the moment?
Yeah, so I think it's gone well. I think a lot of people have had a lot of cows served in the first 3 weeks of mating, and people some farmers are experiencing maybe slightly high rates of repeats.
Yes.
But in general, I think it's been a tough year as well, with grass growth and weather, and I think weather makes such a big difference to any fertility and breeding season. So sometimes it's just out of our control what happens, but in general I think it's been a good year. But obviously farm to farm it can change, and it's just looking at your own farm and finding out why things are happening, and maybe not comparing yourself to the neighbour next door. Just focusing on what you're doing and having a chat with the experts around you.
Yes, and I suppose it's all about improving from year to year.
Yeah, exactly.
I suppose you can only work with what's in front of you.
Exactly, yeah.
So you're farming here at home as well also. Do you want to just tell us a bit about the farm here, Hazel?
So this is my dad's farm. So we're my granddad was here before that, and so I'd be a third generation farmer now, and these are my cows. So yeah, we're milking 55. They're British Friesian type. There's a little bit of Holstein in them as well, in a couple of them. So generally we're spring calving only. We were autumn and spring. We moved over to purely spring about 5 years ago, and so yeah, we've a lot of young cows in the herd, a lot of kind of first to third lactation cows. So they're all, this is the middle of June. They're, hopefully most of them are in calf.
Great.
And I did a pre-breeding scanning on them, and we found a few issues, and hopefully they're resolved now. But generally we've had a great breeding season. And yeah, so hello miss.
Very good. And Hazel, do you use AI here in the farm, or is it stock bull?
Yeah, so we use AI for the first 6 weeks. So we started breeding on the 1st of May. And so we used AI for the first 6 weeks. And then we've taken Scott out of the field today. Scott is over the ditch. He's an Aberdeen Angus bull. So we've had him now for 4 years. So we're very pleased with him. So we've also I've convinced Dad to use a few speckled parked AIs in some of the repeat cows as well this year. So I'm looking forward to adding a little bit of colour into the herd as well. So Dad keeps all the animals. So we have a beef herd as well. They're over there in the distance. So there's all the Angus heifers and bullocks. And so yeah, we're kind of maybe more traditional farm.
Very good, Hazel.
Yeah.
Yeah, no, Hazel, the cows are in super order all together. They're looking great.
Thank you. My dad, I'm very proud. He's a great stockman, and I think his love of cows kind of has been passed down to me, and I'm always you know, looking to see how they're looking at their body condition score, looking at their noses, looking at their eyes, just seeing like their rumen fill as well on the left hand side there. You'll see their paralumbar fossils. You just, you know, they're just general things to look at when walking through a group of cows, and just to see, are they lying down, are they chewing the cud, you know, are they, you know, generally anything below 2.5 body condition score, anything higher than 3.5, you'd be seeing issues then, you know. But in general, that little bracket there, look, there's more fine tuning than that, but generally in that bracket your cows are in good
And
in
would
good
you
order.
kind of do a hard body condition score a couple of times a year, Hazel, or would you kind of focus in on that?
Yeah, we would. Like I generally try to do it twice a year, around drying off and also around breeding, start of breeding. So we just get them all into the crush. Main thing to do would be to really feel your cows as well, not just visual. Feel the ribs, feel the pin bones, feel the tail heads. So yeah, and like when you get them into the crush as well, like generally we kind of do it at vaccination time as well, whether it's IBR, lepto, and we try to think about the jobs when you have the cows in the crush. Try to do as much as you can while they're in the crush, because look, you want to reduce stress and you don't want to be putting them through the crush all for loads of time. So try to think, what else could I be doing here now while I have them? So that's a tip
I do
from me.
a few jobs all in one.
Yeah.
No, that's great, Hazel. I suppose, Hazel, as well, just for the winter and things like that, is it grass silage you feed for the winter, or what kind of a diet would you kind of have your cows on?
We've a very basic diet, just grass silage, and we don't have anything majorly fancy. And then when they calve down, then they get concentrates in the parlour. But they do quite well, and we just be watching whether they go, you know, I suppose going overly fat in the dry cow period is never a good thing to do. So definitely, you know, making sure you're looking at your cows before they're dried off, because when they're 2 to 3 weeks from calving, that's not the time to fix issues. It's before that. So that's the main thing to do.
So winter management is very important.
Very important, yes.
So Hazel, I suppose, what tips would you have if you were a farmer standing out in the field, I suppose selecting livestock, and I suppose watching what things to watch out for, ensuring that the animal is healthy and walking well? Yeah,
so say now this cow, for instance, you would probably look at her eyes, you'd have a look at her nose, make sure it's clear, you'd have her look at her walking there. You can see that her front and back legs are meeting when she so they're tracking up. So her back leg is reaching where her front leg was. Her head isn't nodding when she's walking, so there's no obvious signs of lameness. So she'd be like, she would be a sound cow. Also, you're probably looking at body condition score, but again, it's better to get them into the crush, have a feel of them as well. Just generally no coughing, looking at the fecal consistency as well, looking just to see, are they clean, their coats, you know, are they nice? Like the cow next to her there, she's got a nice shiny black coat. Generally, look, it's not always copper deficiency with brown coats. It can be that the sun has browned them or has turned them a slightly different colour as well. But it's something to think about, is minerals and you know, how healthy they look. But generally, if they're walking well, no coughing, no signs of any snotty noses, nice bright eye and a good rumen fill, that's kind of the general top tips I'd have for picking out cows.
And I suppose, Hazel, as well, if you kind of notice there's maybe a mineral deficiency in the herd, I suppose, what tips would you give? Say, like, how can you look into what's causing it? Like, what tests can be carried out?
Yeah, so very simply would be blood tests. So get your vet out and maybe take about generally between 8 and 10 cows. You can pick, you know, maybe different stages of lactation or different stages of in-calf cows, and you'd take your samples and then you'd get a result back. It takes about 2 weeks sometimes to get the results, but generally it gives you a good overview. Now, if you want to go into more depth, you can do liver biopsies and things like that, which is probably the gold standard for some, but that would be probably a step after the bloods, but it's an option as well.
I suppose if it did come back that you were deficient in some minerals here on the farm, how can you kind of substitute those minerals into the animal? Is it like by boluses or licks? Like what options are out there for farmers?
So I suppose boluses would be something that people would be very aware of, and they're more long acting. If you are at the start of the breeding season and there's a severe deficiency, say in copper or selenium or something like that, then you could use something like an injectable mineral, but that would be vet only. So you'd have to contact your vet about that, and that's a new product available to vets to use. So that would work very quickly. But if you have time, the boluses, the licks can be a great source of minerals too, but I suppose you just have to make sure that you wildlife proof them, lift them up off the ground, and also some cows might bully other cows away from them, so maybe you just have to watch that. Very good, Hazel. Yeah.
And I suppose calves are out in grass now. A lot of calves are weaned calves, but I suppose a slight bit of brownness going through their coats. What advice would you give to farmers in that instance?
Yeah, so generally brown coats, you would maybe traditionally think of copper, and yes, there definitely could be a copper deficiency that could be caused by molybdenum, a high molybdenum in the grass as well, which inhibits copper. So I would say that you ideally blood sampling the calves and finding out what minerals they are deficient in, because obviously you don't want to supplement copper and overdose in copper, because of copper, there is a toxicity level of copper.
So Hazel, thanks very much for having us here today. It was very informative, so it's very much appreciated. So Hazel, just where can people I suppose follow and keep up to date with you?
Yeah, so thank you so much, Rachel. It was a pleasure to have you on the farm and show off the cows and let you know what I'm up to every day. So I have an Instagram blog, I suppose, called Vet on the Move, or at Hazel Mullins, so you can keep up to date there and see what I'm up to every day. And also myself and Michelle Maguire do a podcast called Vet Space Ireland, and it's a place where all vets, farmers, anyone can tune in and see what we're up to, and just give a kind of an insight into veterinary in Ireland.
Great, thanks a million, Hazel.
You're welcome.